I did here with two people, and of course these two people, they are from the same, I would like to put it now,
academic.
They're from the academic. And so, a very robust discussion that we will get this evening for inside this program. First of all, I get Frank Amego. Frank Amego is always come here. Now, analyst, public affairs analyst, but one thing people don't know say in a medical doctor. And a lot of people don't know that about him because he's always coming here to talk because they talk with a pastor and a medical doctor, and the teacher of students for University of Benin. Frank, good evening.
Well, don't give me so many titles now.
Yes.
Okay.
Now you get
people for house, whatever, na day, na good evening.
Okay. We get via Zoom a pro-democracy activist, as we call her, human rights activist, a columnist, and a teacher of students too, all the way from Lagos, Professor Ojo Akaini, senior lecturer at the Lagos State University. Prof, good evening, sir.
Good evening, Prof. Not a do senior lecturer.
Not a senior lecturer. Prof is a prof.
Okay. So go ahead.
That's way behind.
Okay. All right. Okay. Sorry about that introduction. So okay, let's go. Today, Prof. First of all, for the time we know Tay, we can't lose our president. President can't die outside this country. And another former president also can't die in the hospital with that president very day. When you hear the money, when we say that they calculate it, they pay per day, you wouldn't wonder. So, first of all, help us to unpack our health institutions for Nigeria. Because you two, this evening, today, you write one column on Guardian newspaper concerning our health institutions from this country. So let us into that.
Well, I think the place to start is that the state of health for our country is pathetic. They make persons very, very sad. I remember one of our doctors went come out for UBTH in London. So we can't start discussion about the health situation for Nigeria. I see him leave one behind and the health situation for there. He tell me, say, the stage when he leave behind here was where Britain was, in the 1970s. Which means, say, the gap, they far. But the unfortunate thing is, say, this country get history. When we say for UCH Ibadan, president from other country in the late 50s and early 60s, they can't treat themselves for Nigeria. Saudi Arabia, all those Gulf states, their president, they come Nigeria, come receive treatment. Now, so our health system, they superb at that time. But now, we don't lose that glory, And as, if you remember very well, the General Sani Abacha, when they overthrew the Second Republic, they say our hospitals had become consulting clinics among the ease of the society when they take over government at that time. But today, there are no consultants in the hospitals. No consultants. You go to the hospital, the ratio, as so the ratio of doctor to patient for Nigeria, if you do it by per capita on the basis of the population, when we get about 200 plus, is one doctor to 8,000 people. So that will not be death penalty. And the salary when doctor they receive from the most junior to the senior is from 1 point something plus million per annum. For the senior category, about 4 point something million plus per annum. These are the most critical individuals for this country, workers, health workers. When we say any nation will not get good health, you not go feel proceed. And so they are the least treated in terms of welfare in this country. including we when we professor for university, where we earn $400 per monthly, which is less than what an allowance for a junior lecturer in the UK or in the US. So that is, the situation is so bad. That is the situation. No doctors, and in the last 15 years now, many Nigerian doctors, they don't go come up for this country when they call them Jakpa. Then they go look for where they go get better payments, they will get better instrument to work, and the rest of them. Because the most difficult thing for people when they medical profession, they say, you see patients where you know say you go feel make them they alive. You don't get tools where you go make them they alive, and they go die for your presence. Because doctors are trained to save life, but the work for Nigeria can't be say now pain, for them. And as we are saying this, we have had rulers of this country since 1960 to date. Everything good about Nigeria perhaps ended even in 1983, when the Second Republic was terminated, when military take over. Since that time till today, now struggle with the struggle. Now so human beings they die. If the common ordinary disease not kill them, malaria not kill them, these bandits go kill them, kidnappers go kill them. That is the problem we get for Nigeria today. It is very, very pathetic as well. People they talk on.
Frank, see where we did. And they read for Punch today. That is according to the detail we Punch give. That 8 years of former President Buhari regime, Nigerians spent $29.29 billion for medical tourism abroad, and then at the report where it comes from CBN directly. Take out from there.
The way Prof they talking about now, small will talk journal because it goes start from the Book of Lamentations. So I think it goes start from Genesis. So the way the health setup be, doctors they ready to work, but they not get enough facilities. They're not supposed to take light for hospital.
Volume.
They're not supposed to take light for hospital, and the way government don't get interest for the funding, because they get access, as we talk now, medical tourism, they get access to go abroad. Doctors not care about what they happen. A ratio of one doctor to a patient, that's what ratios be. Police or anywhere. Or, so the Nigerian government at any time not ready for anything. Because if you say if anything happen, they'll feel wrong come out for Nigeria. So to Jakba not be commoners next time Jakba. Where Oga Buhari Jakba, we'll see what can happen now. To say repair hospitals for Nigeria. All those millions of naira we can't pay every day. For not that just move from Daura for Casina, enter Abuja, we're not far. Few more to go there. So because we not take care of things, more health workers will come out for Nigeria. Not be prophecy, not reality. They'll come out because they will check how much their mates they get. The same work they do for Nigeria, if you do the same work abroad, you'll see the money we will get. So why you can't sit down, they wait, they suffer. Nobody if you take that risk. So far, the insurance, the health insurance they even bring, federal bring, those states still bring. I sure saw that state still gets. But the problem will get, not be everybody if you enroll into that health insurance. If we want to do something like Edo State now, the first Director General, now medical doctor, consultant, when the administration finish, they can't bring in another Director General, will be lawyer. Marine law, not specialized, but all that one will take handle etc. You don't play politics with human lives. So Edo State government already to ensure say people well. Where doctor the head, he know as he be. But now you can't put lawyer, maybe Director General for Edo Health Insurance Commission. Government not ready. Because nothing like the right person in the position. So because governors, presidents at any time, they will just enter their own private jet, go anywhere of the world where they want to go, receive medical care, and come back. Ordinary diphtheria where they go on now. If anything happen to you, so they go UBTH. These are something where ordinary dispensary, may I talk like that, for supposed to be handled. But most times, dispensary don't get doctor. But most times they not get nurse, not get any health worker. Now these auxiliary people now for there. Not for general hospital. So if everybody want to rush, go UBTH, where they not get enough space, you rush person go there now, the next day they'll talk, say no bed space. And most times again for Nigeria, person can't die as a result because we do religious, you know, God now give, now God now take. Not be true. So government not ready to fix the health sector. And as God Professor Tucker, the kind of things we will get, we will both say archaic. They don't too spoil, they don't old. We no book for Nigeria, just that we don't get facilities. We were surprised who treat former President Muhammadu Buhari, no Nigerian doctor, but they get facilities for the hospital. So now one person get facilities, like if he work, he get a lot of lives will go lost. You will not say, you say this instrument day, if you not finish like that. If you go abroad, person get headache. The first test they do na CT scan. But for Nigeria, they'll tell you how much to do CT scan. You say, no, what, we'll go and go church. We'll go pray for them. No facilities, they don't get access. Now the health insurance, federal, state, they're supposed to handle them. But most times, they're not serious about the thing. I give instance of Edo State, where a consultant medical doctor, the FAB, Director General, as that decision come out, they can't put lawyer. They can't be the Director General of Health Insurance. It has to be now. Not be just ordinary insurance, say the jam motor or house bond. So now health. So now the right person, now you will put there. We're going to understand the feelings here and there. But government not ready. 100% I blame government. Who want to travel, go abroad, go work, make government allow them. One day will come and say, okay, the first start at one time now, that doctors not fit travel. You not get right. Not be you train them. Now your parents train them or now he train himself. So government not get any parts for the life of that training. So if you decide whether I go remain for Nigeria or not. So the health sector, they cry. Apart from facilities, I still agree with Professor that the salary they pay, they make sense. Most times now, salary is not the past 1 week. If you do very stingy, your salary will reach the second week. So everybody will suffer. So doctor when they sick, he come out to come attend to people. You see, they waste time. The man they sick for inside consulting room. No money. They want pay school fees, no money. So all together, we see they blame doctors. So instead of them to stay for government hospital, they don't go to their private clinic. Now they will make their money. Now Nigeria spread the whole thing. Otherwise, why one person will do 2 jobs? Now the bad state of the economy of Nigeria, where we say you run from one work, go to another work, send a side hustle. You're supposed to retire. Most times, person will not retire. As you retire, gratuity don't pay him, pension don't pay him. So that office where he did, he go ensure say he settle himself. So more while are they?
Prof.
Yes, sir.
One forget that. One for missed the track. As somebody who don't follow history. One for missed the track.
Well, I think that the kind of people where they run Nigeria, and they're for missing. Because as Bishop Asakuka tell us, he said those one were drop out for school. Those one were not even work carry school. Now they're in charge of government today. And so what are you going to expect from them? Because you cannot give what you don't have. They don't understand nation duty. For them, now just to go there, the glamour of office, accumulate. That here in Nigeria, you go here say one governor go say he don't employ 120 special assistants. I don't know what they assist on the rest of them. So the money when we're supposed to use for important things, when we make Nigeria day better, stand it back. Now we dey waste for government officials. We dey waste time for long convoys of cars. Now we dey do for this country. Now there we for lose am. Because when you get better leaders, not be mad that they tell you, even for the thing where human beings need, we dey always dey talk am. I mean clothing, shelter, I mean which one be that one food. Those are the key things where man need. And that food is tied to your health. And if something go wrong, now doctors, now they go take care of people who are not well. And any country where not take care, provide food for a citizen, you not get good medical care. When you take care of citizens, when they get malaria, when they get yellow fever, when the epidemic break out, then that country not ready. So now the people when they rule us, because they don't see Nigerians as human beings. They treat Nigeria as things, not as human beings. Now the problem we get for this country now be that. Because I mean if you walk out the streets of Benin now, you see people that are almost like walking dead. People who are dead but walking. Those you say they not eat, they are not in good health condition. You can see it on their face, written all over. Even others, when they work out, a cloth they cover with their body. So it's so terrible. I don't know how to get one, but we when they do political science, they say we need, a new way of elite recruitment. Where would be say the people when they better pass for our midst. Now we put for government. Where would we take government work out? Where do we say government? Now social responsibility, not be for prestige. Say you go there accumulate all the things when the executive prepare the state. Until we get that kind of people, we're not going to go anywhere. And the unfortunate thing is say these bad leaders when they rule us, when they finish, then they put their king. When they call them incestuous leadership. Now they happen for Nigeria now. They could put their picking for House of Assembly. They could put their picking for making a commissioner. Now those things they happen. And so the same cycle of misery, when our people they go through, they continue. So now they be until we get people where no say government now about people, not about any other thing, we cannot go get out of this. If you go abroad, as my brother was saying, the best medical doctors are Nigerians. This I can tell you. When I do students for there, the best the orthopedic doctor in Birmingham was a Nigerian. The chief orthopedic doctor there, na Nigerian. All the key places when you go, na Nigerians go see. And so the thing tire also say we get leaders. When not they do retrospection, when not they think about today and tomorrow, when not they think about the future of the country, and that one be the real problem. The only, as we say, Messiah not going to come from anywhere unless our people take their destiny for their hands.
Okay, Messiah not going to come from nowhere. So as we need to wrap up this topic, what would be some possible solutions?
Solution for e-day, but those who want to make the solution, they don't agree. For instance, you can't pass law, say nobody will go abroad again for any treatment. All children of Nigeria, we were born for Nigeria, they're supposed to go to school for Nigeria. But those who want to make the law, they don't agree. They're guilty of that act. So they don't fulfill help well. If you tell government now, they go promise you something, but they don't do one. As they promise, you come out, they start to laugh. Like unions now for various unions for Nigeria. Why did they go on strike? Now government promise you. As a promise finish, now to end from one government to the other. So the best solution for be any treatment, like Aso Rock Villa now, it get clinic. Old former president's wife, Buhari, she complained that time now. Say syringe not there. But they vote billions of naira every year. Okay, why recently, President Tinubu, they said about we going put solar for Aso Rock or more bad generators. That means they not guarantee electricity. Another one of the things he said when they campaign, say, as he become president, before he knows it happen, light go there everywhere. But since he entered now, as it was in the beginning. So, government not serious, as I listened to Prof just now, they don't care about you. If they tar any road, they tar the road because they'll get money from inside. If the road ever bad, where they don't come inside. If one small pothole, they don't do them. Because how much will do the pothole? They say 1,000 naira. I say no, never spoil rich. We're going to be 1 point something billion. They'll carry caterpillar come. Where if we get their own? And they do the road finish, nothing will happen. So the same thing, I don't care attitude, now they happen to health sector. Not the only health sector, all the sectors, which one they work? Is it petroleum or anything? Not the one they work. So my general attitude to make sure say Nigerians go suffer for their hands. And that's also political game. Once they don't make Nigerians suffer, any small thing you give them, the day one vote, 5,000 naira, they will start to fight to make sure so they get the 5,000 naira. So government not ready. The only solution why for talk, the people know will do them. So no need. That no movement. Who want to treat himself, whether now ordinary malaria, now surgery, do one for Nigeria. Bring the facilities. If they bring facilities, a lot of Nigerians will live long. But as it be now, the life expectancy, how long person will last for Nigeria, it's in your own hand. You make sure say you struggle. They say may eat balanced diet. You don't even see diet already. You don't see diet, don't talk about say balance. 3 square meal, not a rectangular meal. You look for any how to survive. That they cause violence, all forms of crimes and criminalities that in a society they find it difficult to see upright person, to see sincere person. So government effort, so the solution ultimately for B, if possible, no movement, no medical tourism. Your children will go to school for Nigeria, fix all the schools. Now public school I go all through. From primary till now public school I go. But now, if you go any public school now, you will regret. If I hear of my former secondary school, you know, blessed that kind of school I go. so many things. Old system, they see people they up to now in Nigeria, they sit down for ground for class. So they go arrange block, pull wood across. Now be their class. At times you'll see 1 or 2 teachers, the whole of primary school, primary 1 to primary 6, 2 teachers. So not just head setter, not everywhere. So it's unfortunate.
All right, so if you are just joining the program where they watch now, UDUOTA means heart of the matter when they reach them from independent television. We'll take one short break now. When we come back, we'll enter the next discussion. Prof, before we enter the next discussion, just maybe in a lighter part of it, just some possible solutions to this issue. We see it don't linger for a long time.
Well, as I talked before, Messiah not there. Now we human beings go feel it better. Now if we get good government, now what the government will do? A health problem, not be a person where philanthropist go can solve. Now government when we give them power, when we citizen vote for, say may they take us the waka. Now then suppose prioritize them, make number 1 for their list. For instance, our state get close to about 315 primary health care centers. They exist on paper. In the last years of previous governments, they were appropriating for them. But if you go to where they say all these primary health care centers, they now push. So the thing is say we need people when believe in the people, when they fear God, when understand what that the government do, not be for yourself. Selfless, what they call it, selfless service. And health, now one of those primary things where we say no matter whether government perform or not perform, these are priority things like education, health. These are not things when any government when serious supposed to play with. Because the thing about health be say, na equalizer. There's nothing like rich man or big man. If I say big man, na they even get big disease past the poor man. And so the facility for health is supposed to take good for everybody. So we don't need to tell government, we understand what it be governance. Say you must prioritize health care. You must provide the facilities. You must make even our own country a health tourist center where other people from other countries, small West African states, Africa and Obodo Igbo, when they come say we get special, treatment. For example, the Dominican monk in Ehu, even the herbal medicine that they are doing there, people from England, London, they go take treatment for those herbal medicine when those Dr. Adodo and others they do for there. This is the way it should be. That waiting they afflict us as human beings, we get solution to them. So to build the health center, not be rocket science. So when they see say some of our leaders they do, the more you look, the less you see. Because they don't say they build some hospital, even for our state, carry all kinds of equipment. They say they borrow and that's why here. Say they borrow and come show say this place they equipped. After the camera don't come out, the whole thing they empty. So now the Wayo people when they take us waka, now be the problem. So make we be citizen for under democracy when get the power to elect people, vote out those who know mean well for our people, who don't know what to do about governance. We need to prioritize health. If we don't get health, you don't go get healthy citizens now. Development not go take place. So the team be say, make we try. The power, they're not a giver for platter of gold. Though. Somebody go carry power, go say make you can't take. Then they fight go for that power. Not be the one when they say they shoot gun now they talk. But the one when you go say, you start getting back. Say now this man I vote for, now he go take us waka. Not be say they will come take that power when you give to another person, give out to another person where not merit. Now there the solution there, my people.